Again, everybody, coming to you from the Ross County Health District offices on 2nd Street here in Chillicothe, Ohio. And with us today, we have, once again returning, Ben Avery and also Michelle Long. We want to take a moment to give this week's update as best we possibly can. For those of you that have been watching, we are now under a stay-at-home order that was signed by Dr. Amy Acton yesterday, placed into order by Governor Mike DeWine. If you've read through the order, it doesn't change much. I mean, it's all pretty much stuff we've been ramped up to where we are at this point in time. So what is the latest you have to report to us today, Ben?
Yeah, I think the stay-home order is one of the big issues that we wanted to talk about today. And like you said, not a whole lot has changed, but I think it was a way for them to kind of amplify that stay-at-home message. If you were noticing in the introduction to the stay-at-home order, they said two people were going to enforce this, the health department and the police or sheriff. So we do have a role in enforcing that. So we've been getting a lot of calls today. And, I guess my biggest message for people that are wondering if they're an essential service, if you have to ask that question, you are probably not an essential service. So that's one of the big messages we're wanting to get out there is, if at all possible, stay home because we need to protect those vulnerable populations.
Of course, the state is using the Homeland Security guidelines, so you can find those 16 sectors on our website at littermedia.com. You can check that out. There's a link in the story from where we were talking about the stay-at-home orders. So you can go there to find out if you're, and hopefully by now you've heard from your employer whether or not you are indeed essential.
Well, the health department is trying to follow what we are advising other folks to do. So a majority of our employees are now working from home. We still do offer essential services, but you may not be able to access those services as rapidly. Normally you'd be able to get a birth certificate in a half an hour. Now you need to call in, and we're going to have to mail that out to your house. But a lot of our services are still accessible, but just not as convenient as what they once were.
And even something like a birth certificate, unless it's an absolute necessity, you can wait till this is done.
Right, or you can wait for it to come in the mail for sure.
What else do we want to touch on today?
Yeah, I would like to touch on the Medical Reserve Corps. It's something we're trying to get up and running. We actually do not have our first case here in Ross County yet, but we expect that's coming at some point. And we may need some volunteers, people to come and help with things like contact tracing, where we take that confirmed case and then make contact with anyone they've been in contact with and let them know what they need to do. This is for medical personnel, public health professionals, and those in the community who do not have that healthcare experience. I mean, they don't have to have healthcare experience. So anyone can be a part of this if they know how to use the phone or know how to make copies or anything like that. And we are having an informational meeting on our response and readiness this Wednesday at 5:30. And it's going to be actually a video conferencing meeting. We have put that on our Facebook page where people can link up to that and get hooked in. And also today there'll be a link on our website where people can go ahead and go into Ohio Response. That's how we're going to organize all the volunteers, and they can actually sign up on that website to help us at a point when we need it. And this will be something we'll be using in other responses too, but we're getting it started now with the COVID-19.
And if you're seeing this now for the first time on this video, look in the description. We've got that link for you there as well.
Yeah, we appreciate you getting that out for us, Dan. I think if you look back to the H1N1 response that we had in 2009, 2010, the Medical Reserve Corps was vital in helping us staff immunization clinics and answer the call back then. We have nurses here that will be able to administer shots and those types of things, but there's a lot more that goes into setting up a clinic, than just having the nurse personnel there. We need crowd control. We need people to help with paperwork a lot of times. In this situation, like Michelle said, it's going to be doing that initial contact tracing. If somebody was confirmed positive with COVID-19 and they went to a movie, we're going to try to contact as many people in that movie theater that were there that night as we possibly can. And you can see how that will quickly start to reduce the resources we have at hand. So we are starting to seek volunteers. And there are ways I'm sure that we haven't even thought of that we could be able to use volunteers as we move forward.
And the volunteerism, let's move on to 211 because that's a vital resource and through the United Way of Ross County, but you can also volunteer by calling 211.
Right. The United Way is also offering volunteer recruitment as well, so you can go to their website at the United Way or through 211 if you want to try to give back to the community as well. We're certainly not trying to compete with the United Way. I think we're just going to need as many volunteers as we possibly can as this starts to unfold.
I think somewhat of our volunteers with the Medical Reserve Corps will probably hit more on those nurses and things and people who actually, when speaking to someone, could actually work them through the entire process. So I think the United Way will just get, the possible just community member that doesn't have that kind of healthcare professional degree or anything, and we might be able to pick up more of the medical professionals.
I'm thinking of our most vulnerable populations, the elderly that don't have somebody to look after them on a daily basis. We really want them to stay home. So if we had volunteers that were able to deliver meals, I think that would go a long way to meeting the needs of those folks that really do have to consider whether they want to step out their front door every day. The last thing I would mention is that we are in a desperate lack of personal protective equipment for our healthcare staff right now. Our home health aides, doctors that are our EMSs, we're running out of N95 masks specifically is what we're concerned about. So I know there are some industries out there that have a supply of N95s. So we're just asking, veterinarians, cosmetologists, construction workers to look in your inventories, and if you do have any N95s or masks of any kind, we ask you to donate those to the Ross EMA, the Emergency Management Agency. And Dan, you'll be able to provide that information as well, I hope.
Yeah, absolutely. Paul Minnie's been keeping up to date on a lot of this information that we're sharing here today as well. That being said, I know that as the president in his Sunday news conference was mentioning, much of this is being made rapidly. It's a matter of when it comes to the states. And I know the governor has been given the leeway of trying to find that stuff on the behalf for Ohio. So trying to cut out the middleman, so to speak, to be able to get it quickly to us here.
Yes, we've had a number of calls from private agencies that are on their last box of N95. So it really is getting to be a crisis. I will tell you, though, that we got our first delivery from the Strategic National Stockpile today. So there is an allotment for Ross County that came in, and it does include some masks, some gowns, gloves, those types of things. But we're still going to need more to supplement that amount that we've gotten today. Because
even though still today the numbers are low, we're projecting what we may see in the near future.
Right. We know that the coronavirus or COVID-19 is in our community right now. It's just a matter of having that right person get tested, and we'll start to see those numbers grow. We're doing our best to limit that spread, but we're operating as if it is out there, and it certainly is a matter of time. You can see Highland County reported their first case today. I believe Gallia reported their first case on Friday. So it is really starting to close in on us, so to speak.
And I think, as Dr. Acton had mentioned in one of the news conferences, that some of these reports are in the larger areas because they're going to the hospital, and that hospital is reporting it in that county. So that could very well be somebody from Pickaway County or here in Ross County as well. So, any final words? I
think let's take care of each other. This community is really, really doing a fantastic job responding. Mayor Feeney has a coalition of community leaders that are addressing hunger, economic conditions, So if you want to get involved, there's many outlets that you can do that, and we just wanted to try to make those available and publicize those today. So
Continue to wash your hands, practice the social distancing as we have been doing here today. You can see we can't touch hands. You can see that I gave blood today as well. Do give blood. That is an essential entity, an essential sector, so to speak. So make sure you contact the Red Cross. They've expanded when they are giving it now, or taking your donations, I should say. Monday through Friday now, not just Monday, Wednesday, and Friday, but expanding it all 5 days, 9:30 a.m. to 3:30. You can do Rapid Pass. You can also you just walk in, or you can make an appointment as well, redcrossblood.org. Thank you again for joining us, and we will see you hopefully next week.
yep, thanks, Dan.
Yeah.